the magical room, and we have an immense number of folks who are from all kinds of places with different concerns about getting our arms around the HIV epidemic. It is immensely reinforcing. I mean, there's a lot of dopamine flowing in my brain right now. But as I was walking the dog this morning, I had this thought, you know, our fight's not over. 30 years in, 35 years, HIV's been in Los Angeles County. And I was remembering, you know, I lost a patient just a week and a half ago to HIV, mental health, and substance use related problems. He wasn't poor, but he had been struggling with these issues for a long time, 11 years. And he said enough, and he passed. So, you know, it is wonderful to be here. This is the best of government in action. We have all of our funders from the federal government here. We have our state funders. We have our public health departments. We have clinics. We have patient advocacy groups. We have artists. We have all kinds of people represented in these tables. I've never seen a room quite as amazing. So, you know, I want to just sort of take a moment for everyone to kind of remember folks who we've worked with, to remoralize why we're here, that we're involved in the fight of our lives, and that we have this opportunity, and that this day is organized around putting some structure around all this energy, so that when we leave this room, we have a different approach to begin thinking about ending HIV in this region, not just Los Angeles County, but our sister counties and our sister counties in the state. So a little emotional, but it's something that I've been working on for 30 years, as many in this room, and it's time to actually kind of think about a different approach, begin to think clearly, and to make efforts to put services out and to make requests of our funders, so that as we do this, we can actually see the change that we want to make. So I want to start by thanking folks. There's so many people who I can't even start with going down the list of calling out people, but I will start with one, and that is Wen Cao. Without Wen, it would not be happening today. We wouldn't be here, we certainly wouldn't have food, and you probably, it just would be bad. So I want to thank her. The planning committee, you can see your names up here. I don't want to go by name. The CHIPTS members, the local planning partners, everyone in this room has been incredibly supportive of the motivation for today. Support, you know, I want to call out Chris Gordon, my program officer for CHIPTS. He's been an ally in the fight here in Los Angeles, and you know, we have a different epidemic than they do in the East. And Chris is one of the few people who've been willing to actually argue that that is the case and that we need to do things differently. So thanks, Chris. It's been a great long walk, so I'm glad you're there. As well, the AIDS Coordinator's Office, you know, I don't know if Ricky is, I'm sure he's here somewhere, and I saw Dahlia. But AIDS Coordinator's Office has always been helpful and, you know, supportive of us as we move outside the lines to address people who aren't covered by the general approach. The Family Medicine, the AIDS Institute, Mario is here, DHSP, the AETC, the California Office on AIDS, the Commission on HIV. We are all together here today. And of course, I would be remiss if I didn't recognize our cab at CHIPTS. These guys, I don't know if you can stand if you're in the room, but these guys have been involved with the HIV effort for many years, and they infuse us with new ideas, new energy, and all kinds of other thoughts. Some of them will be speaking with us today, and with that, I think I'll get started. So, what is the motivation for today? Well, you know, it started me thinking recently that, you know, we can agree that there should be no more mother-to-child transmissions of HIV, but we have everything in place to be able to make sure that there are no other HIV transmissions for people who inject drugs. So why aren't we getting exercised about the needs of people who inject drugs? Why are we not engaged about people who use other substances? We have tools. We can do this. We can get this under control. The issue is we have these tools for treatment and prevention. We have these pillars that are organizing these efforts. But what we need to think about is getting to the point of having an approach and a plan to get to zero that makes some sense. So where are we? Well, we can see here, we put some slides together. These are from the surveillance reports and from available online data. And we can see that we have a lot of folks around the state who are living with HIV, whether you look at number or rate. We can look at new diagnoses. These are 2017 data. And you can see here that there's an unacceptably high rate of people getting infected with HIV. And we can see here that if we look at the HIV care continuum across the counties, that we have a lot of folks who are being diagnosed, a substantial number of folks who are being linked to care. And we have some work to do in getting that last bar up, which is getting people virally suppressed who are living with HIV. One of the reasons why we're having a regional meeting today is because as we went through those 3 slides quickly, you can see there's a variety of responses by where you are. If you're living in San Francisco County, if you're living in Los Angeles County, if you're living in San Bernardino County, if you're living in Riverside County, you can see that there are different responses that are going on there. Does that mean that there's what that means to me is we need a day like today to begin thinking about how do we bring up people who are doing well or not doing as well, and how do we learn from people who are doing, you know, exceptionally well. So that's part of the reasons why we're here. The other thing I want to leave us with today as I welcome us and get us into the day is to be smarter in our thinking. So what we know is that for about 80% of people who are living with HIV or at high risk, they do just fine taking the medications and using the tools that we have available to them to be able to maintain the virus or to prevent being infected. And my word is, let's leave them alone, okay? What we need to do in the next 10 years, this is my next decade of work, is to focus on that 15 to 20% of folks who, for whatever reason, can't do it. That we need to be able to think about tough decisions that are going to affect that 15 to 20%. So I think as we've had these great successes in terms of being able to provide treatment and prevention, we need to begin thinking about how do we reach out to the other 15 to 20%. And it's tough, because what we know is that there's an ongoing erosion of the availability of health resources across our region, whether it's the ability not to get to care, or once you're at care settings to have stigma or other things happen that interfere with you being able to access drug or to be able to get prevention needs. We know that there's a chronic problem that's not being addressed evenly across the region in terms of people who are living with or living with others who have substance use or mental health disorders. These are disorganizing factors. They influence people's behaviors in ways that interfere with them being able to take a medication regularly or to engage a behavior risk program in a consistent way. And we also know that we have this increasing problem with poverty. It's one of the most horrible things that's going on right now in our region. As someone who loves LA, it's really tough to be at 6th and Spring at 8 o'clock in the morning. It's really tough to be walking around different parts of town where you see in this just obscene discrepancy between people who have so much resource and people who have nothing. So what happens, why we have to think this way, is because when you bring these 3 elements together, you have the opportunity for HIV outbreaks, and once outbreaks start, to continue the progression of HIV. So this is why we're here today, is to begin to think about, and I'm going to challenge this room, that for the next decade, that we should be thinking about making available the tools that we need to give to people who can do just fine and do an easy touch on them. Write the check, they're fine. And then to double down on this group that needs more. If we don't, we will virtually assure viremia in the population that will interfere with us being able to get to zero. And that's exactly what Bohdan Nosek has been able to show. Bohdan is right over here. He is a modeler. He's from the University of British Columbia, and he's been working with us. I've been working with him, but he works with public health data to begin to think about what happens if we continue to do the same amount of work on the HIV epidemic. And LA County, we know it's very unique here, that this isn't San Francisco, this isn't New York, it's not Seattle, this is Los Angeles County, which is a region. It's not, I mean, it's a place that's broad. So in terms of thinking about implementing programs, we have to think beyond the borders of our county or the mountains that can, keep us from going into Palmdale, Lancaster, which is another discussion for a different day. But because there's a public health crisis happening in Lancaster and Palmdale. So what Bohdan did was he took the data from 2012 to 2015 and just asked the question, what would happen if we continue to invest the same amount of resources, not looking at so much about what we're doing, but just this amount of resource in the next 25 years of the epidemic. And what you can see here is that nothing happens. We continue to have the same thing happening. All right, so for a simple guy like me, what that means is we have to change our thinking. All right, so we need to do something different. I don't know that we need more money, but we definitely need to do different things with our money. And that's kind of why I want us to think about the structure of the day and being able to think about, let's leave aside the issue of people who are doing well, and let's start focusing in on the people who we need to lift up and get these problems under control. So we're going to start with talking with our federal state representatives, our county leaders, our community stakeholders about suggestions and opportunities for a regional response. And within that regional response, I'm going to hold us to being able to address the issues of people who have substance use, mental health disorders, and access to structural determinants to health. Because it's not just a simple put a Band-Aid on it. I mean, we learned this from Africa. We saw Ambassador Birx go in and do a major response. We saw huge responses in the HIV infection rate, and then it hit the plateau. And